What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening. Hello, and I am so excited to welcome today to the podcast Dr. Eric Osansky. Dr. Eric is a longtime friend of mine, and I have been on his podcast and in his summits. It's super exciting to be able to host him on my own platform here at the Inflammation Investigator. So let me just tell you a little bit about Dr. Eric Osansky. He is a chiropractor, a clinical nutritionist, and a certified functional medicine practitioner who has been helping people with hyperthyroidism and Graves' disease since 2009. He's the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves' disease, The Hyperthyroid Healing Diet, and Hashimoto's Triggers, and is the host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed with Graves' disease in 2008 and was able to restore his health through a natural approach. Dr. Eric, thank you so much for coming on today. I'm so excited to talk to you about inflammation and thyroid.
Yeah, thanks, Elizabeth. Excited to be having this conversation. Yeah, it was a great having you on my podcast a few times. You were on a couple of times, and
A couple
like you
times,
said,
yes.
yeah, my summit, my the thyroid summit I had recently, and yeah, really excited to be on your podcast now.
Great. So I know we just heard your introduction, but why don't you tell us a little bit about how you got into working with thyroid and what your protocols are all about?
Yeah, well, so I had my own, as you mentioned, I was in the past diagnosed with Graves' disease, and prior to that, had really no experience with Graves, and just was practicing chiropractic. That's my background, a doctor of chiropractic, and um, but as a chiropractor, we have to take, just like most practitioners, we need to take our continuing education credits, and I always used to take nutrition and functional medicine seminars, whereas a lot of other chiropractors would take technique seminars to improve their
Uh-huh.
chiropractic technique. And I almost never took technique seminars. I just took nutrition, functional medicine. And coincidentally, there were a couple of functional endocrinology seminars. And little did I know I would need to use those the information from those seminars on myself. But yeah, they focus more on hypothyroidism, Hashimoto, just because that's more common, but they did talk a little bit about hyperthyroidism and Graves. And so when I was diagnosed with hyperthyroidism in 2008 and then eventually Graves' disease, I knew I was going to at least attempt a natural treatment approach. I didn't know anybody who did that and was successful. So I was a little bit nervous and skeptical, but I figured, hey, there's got to be a cause behind this, and so yeah. Long story short, I managed my symptoms naturally. I was able to avoid the anti-thyroid medication commonly given to Graves patients, and then just did things to address the cause of the problem, reduce my inflammation, and yeah, restore my health. And then just realized that there are so many people out there with thyroid and autoimmune thyroid conditions, and so I started helping others, and just over the years, even though I've written a book on Hashimoto's and I've worked with Hashimoto's patients, but these days most of my practice consists of people with hyperthyroidism and Graves just because of my background. And then there's just not a lot of practitioners that are focusing on hyperthyroidism and Graves. Most like in the podcast space, if you listen to most thyroid related podcasts, they focus on hypothyroidism and Hashimoto's. Mine is one of the few that focuses a little bit more on hyperthyroidism and Graves. So yeah, that's my backstory.
So for the benefit of our listeners, can we talk a little bit about the difference between hypothyroidism and hyperthyroidism and Graves and Hashimoto's?
Yeah, so well, let's talk about the thyroid hormone. So you have
Okay.
so yeah, and then we'll kind of differ. So there's the main thyroid hormones, at least those that could be measured on a blood test. You have T4 and T3. The thyroid gland produces mostly T4, and then T4. It does produce some T3, but most of the T3 is produced by the conversion of T4 into T3, and T3 is the active form of thyroid hormone. So with hypothyroidism, when you have low thyroid hormone, again, that's what you have low T3 and T4. When you have hyperthyroidism, you have too much T3 and T4. And then there's also a hormone called thyroid stimulating hormone or TSH, which is actually a pituitary hormone, and that communicates with the thyroid gland. And so in the case of low thyroid, when someone has hypothyroidism, it's going to tell the thyroid gland, let's go ahead and produce more thyroid hormone. So you get increases in TSH. Whereas with hyperthyroidism, and you have too much thyroid hormone, it's trying to communicate to the thyroid gland, we don't need any more thyroid hormone. So you have really low amounts of TSH. Because it's trying not to stimulate the thyroid gland to produce thyroid hormone. So hypothyroidism, you have high TSH, low thyroid hormones. Hyperthyroidism, you have you have elevated thyroid hormones, low TSH, and then you have different antibodies. So most thyroid conditions are autoimmune in nature. Approximately 90% of people with hypothyroidism have Hashimoto's, and the same with hyperthyroidism. There's different hyperthyroid conditions, but about 90% of people have Graves, and they involve different autoantibodies well, the most common antibody, thyroid antibody, is called thyroid peroxidase antibody, TPO antibodies, which are more commonly associated with Hashimoto's, but a lot of people with Graves also have those as well. And then there are thyroglobulin antibodies, and those are definitely more specific to Hashimoto's. And then there are thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody, and those are associated with Graves. So if someone has hyperthyroidism, again, elevated thyroid hormones, low TSH, elevated or positive thyroid stimulating immunoglobulins. That's pretty much diagnostic of Graves, where if someone has elevated TSH, low thyroid hormones, and the thyroglobulin antibodies or the TPO antibodies, that's diagnostic of Hashimoto's. And then, of course, there are different symptoms associated with hypo and hyper. When someone has low
Yes, let's
th
talk about those.
yeah,
That's what I'm
yeah.
really interested in hearing.
Okay, yeah. So symptom wise, someone when they have low thyroid hormone, usually they're going to experience fatigue. They're going to experience weight gain. They're going to experience coldness is pretty common. Brain fog. I mean, everything is slowing down. So constipation is pretty common. Um, Graves, it's the opposite. You have the increased thyroid hormone. So everything's like revved up. So yeah, when I dealt with Graves, I had increased resting heart rate. I had heart palpitations. I had tremors. I lost a lot of weight. I was 182 at the time, and I was actually trying to lose weight, but what my normal weight is like 165 to 170. I went down to 140, so I dropped 42 pounds, which is pretty extreme. And yeah, and then heat intolerance, loose stools, hair loss is pretty common with both, with any type of thyroid imbalance, so hyper or hypo, anxiety with hyperthyroidism, whereas like with hypo, depression is more common. So yeah, those are some of the different symptoms uh, between, when it comes to both hypothyroidism and hyperthyroidism.
So you said you lost 40 pounds. in a short period of time, how does something all of a sudden start going wrong with your thyroid? Like you were fine before, and then all of a sudden something was going wrong and you lost a ton of weight. Like what what happened to trigger that thyroid malfunction? Do you know?
Yeah, it's a good question. I mean, there's what's called the triad of autoimmunity or three-legged stool of autoimmunity. And of course, that's not specific just for Graves, but with all autoimmune conditions. So there does seem to be a genetic component, genetic predisposition, but then there's exposure to one or more environmental triggers. So the second component of the triad of autoimmunity. And then the third is an increase in intestinal permeability or a leaky gut. And so I talk about four categories of triggers. I know you
Hmm.
deal with MS and, like you've had MS and helped others.
Yes,
So again, I'm sure there's definitely overlap, but so,
for sure.
some will say like nutrient deficiencies are a trigger, but I consider them more of an underlying imbalance. So food, stress, chemicals, infections are the four categories of triggers I talk about. And I mean, in my situation, I know stress was definitely a factor. I mean, like the emotional stressors, but also I was overtraining. I wasn't listening to my body, and I wasn't running marathons or triathlons. I was just at the gym, and I was doing a lot of cardio, and I was wiped out, and so I'm sure that combined with emotional stressors, and I was in denial honestly until I did an adrenal saliva test, and I know not every practitioner does adrenal saliva testing, but I like adrenal testing because in my case it convinced me. Like if I didn't see how bad my cortisol and DHEA were, everything was low. Um, Again, I knew stress was a factor. I just thought I was doing a good job of managing it. So I was overestimating my stress handling abilities. And so stress was a big factor. I mean, diet. At the time, I can't say I was gluten free, just which also could
Uh-huh.
be a potential trigger. And obviously these days we've learned a lot when it comes to gluten. So this was back, 2008, 2009 when again it was known, but still not like today where like everybody's like knows, hey, you should avoid gluten,
Right.
especially if you're dealing with autoimmunity. But yeah, so I mean, those definitely were, I think, two factors in my situation, but obviously everybody's different. Like during the pandemic, with COVID, we had a lot more people come in with hyperthyroidism. So COVID, like, and other viruses like Epstein-Barr could
Hmm.
potentially be triggers. And we live of course, in a toxic world. And I think that's one of the reasons why we
Yep.
have the increased prevalence of autoimmunity, just because of all the different toxins and toxicants that we're exposed to.
Yes, yes. In fact, I was just reading something the other day about phthalates in our environment and in all of our products and how really they should have been banned completely 40, 50 years ago, but they haven't been, and we're so far behind now that to even um, to make any kind of a dent in getting them out of our world is just going to be monumental, and how harmful they can be, especially to pregnant women and
Hmm.
developing children, things like that.
Yep.
So, okay, so you're focused on Graves, which is hypothyroidism. No,
Hyper. Yeah.
hyperthyroidism.
Hmm.
Hyperthyroidism. I'm going to confuse those the entire episode, I'm sure. Okay.
That's okay.
So, so how do most people start to realize that they're having a thyroid issue and need to go figure it out?
Yeah. I mean, it honestly varies. Like with me, I didn't know, even though I was losing weight, I was trying to lose weight. And so I didn't put the pieces together until I was just walking around a retail store and they had one of those automated blood pressure machines. And I took my blood pressure, which was fine, but my resting heart rate was 90 beats per minute. And then I would take it manually the next few days, and it was anywhere between like 90 and 110 beats per minute. So that's how I realized something was wrong and ended up seeing a primary care doctor initially, and who did just like a TSH and a T4, and then that showed that I had a hyperthyroidism, and then went to an endocrinologist. But sometimes, Sometimes people are just getting like a random blood test and they might have TSH run and then they see TSH is really low or depressed and then that leads them to do further testing. Sometimes it's obvious like someone will like feel really anxious and have other symptoms. But again, it's obvious something's wrong, but sometimes they might be told that they might not have their thyroid tested because maybe they're having symptoms of anxiety and the again the person refers them to a psychologist or someone else depending on the symptoms and then sometimes there's a condition. I don't know how familiar you are with thyroid eye disease. So thyroid eye disease is what Graves a lot. It's pretty common for the immune system. That's the same autoimmune component for Graves could actually
Hmm.
attack the tissues of the eyes and cause symptoms such as eye swelling, eye bulging, double vision. And I can't say it's common, but I mean it's common to have thyroid eye disease, but it's not common where that's the sign, like where someone has it and that's where they figure out they have Graves. But over the years, I've had a few people where, that they started having eye symptoms first before anything else, or at least noticing the eye symptoms. And then they went to an eye specialist, like an ophthalmologist, and then found out, yeah, I think you have thyroid eye disease. And then they got a thyroid panel, and sure enough, they had hyperthyroidism and, the antibodies were positive. So yeah, there's different ways of finding out. Hashimoto's could be even more challenging because there are a lot of different things that could cause fatigue and weight gain and
Right.
and some people just dismiss it as I'm like not getting enough sleep, which of course can cause fatigue. I'm working too hard. I'm not eating great, so that's why I'm
Uh-huh.
getting the weight gain, and doctors might say the same thing. So there are people with Hashimoto's that might go 10, 15 years without it being diagnosed. And then finally, same thing. They might not get diagnosed until maybe they'll get a TSH, and the TSH will be high. And then after that, the doctor will dig deeper, or maybe they see a functional medicine practitioner, and the functional medicine practitioner actually does some testing and doesn't just say, "Oh, your weight gain and your fatigue and other symptoms are just, normal. Just you need to slow down a little bit, get more sleep." And again, that could also cause some of the symptoms. But yeah, so there are different ways, and again, a lot of people get misdiagnosed, and it could take, like I said, sometimes many years before someone gets that diagnosis.
So, how does your approach to dealing with Graves and hyperthyroidism differ from the traditional medical approach?
Well, traditional medical approach, there's really three solutions. One is medication, typically anti-thyroid medication like methimazole or PTU. Second is radioactive iodine, which is as scary as it sounds, using radiation to ablate or destroy the cells of the thyroid gland, and then thyroid surgery, removing the thyroid gland. So, the thing is with Graves, it's an immune system condition, and I'm sure you know this. If you have one autoimmune condition, you're at greater risk of developing other autoimmune conditions in the
Yeah.
future. So I mean, some people do need antithyroid medication, even though I didn't. I took a more natural approach to manage the symptoms, but some people do need the meds. But radioactive iodine and thyroid surgery are extreme measures. And even if someone were to get their thyroid gland removed, if they had Graves and they did that, they still would want to do things to optimize their immune system because again, they still will be at risk of developing other autoimmune conditions in the future. So my approach is to try to save people's thyroids and just symptom management. I took herbs called bugleweed and motherwort, which you might have not heard of. They're not too common. It's not like ashwagandha and other herbs that are everywhere. If you go to a health food store, you're unlikely to find bugleweed. But bugleweed, it's an herb that has anti-thyroid properties, and motherwort is an herb that kind of like a natural beta blocker. And then
Mhm.
L-carnitine, which I'm sure you're familiar with. There's some studies showing L-carnitine in higher doses can also block the entry of thyroid hormone into the cell. So there are natural agents to manage the symptoms. But then, of course, the key is to address the cause of the problem, to, find the triggers, find, whether it's again food, whether it's parasites, whether it's environmental toxins, intoxicants, and just And again, doing things to heal the gut. And so just about every endocrinologist out there, there are exceptions. There's a few integrative endocrinologists, but most of them, again, they're doing absolutely nothing for the cause of the problem. But even worse than that, they're discouraging patients from improve in their health. I mean, I've had countless patients over the years just ask their endocrinologist, I have Graves' disease, I like to change my diet, reduce my stress. And usually the response is, don't bother. That's not gonna help at all. So where I would like to think if I was a conventional endocrinologist, I might not believe in that approach, but I might say, well, it's not gonna hurt. Like, I don't think that would help, but it never will hurt to clean up your diet and manage your stress. And who knows? I mean, I still would recommend if I'm an endocrinologist, say, yeah, I recommend the medication. But yeah,
Uh-huh.
it's not going to hurt to like combine, a natural approach, as long as you're doing it safely. But again, even like diet changes, they're usually like, no, diets doesn't make a difference. And some people unfortunately believe that. And I mean, so many people have received radioactive iodine thyroid surgery and again, not to say there's not a time and place, but arguably, I don't know for radioactive iodine, but for certain, again, time and place for surgery. And yeah, like I said, mo it should be a last resort after everything else has been tried, or if someone has, like, if they have a goiter, like an enlarged thyroid, and it's like causing an obstruction, where they're having difficulty breathing, swallowing, things like that. I can understand. Thyroid cancer, and even that. I'm not a cancer specialist, but I'm sure there are others. Definitely are other people that focus on holistic treatments for cancer. But
Mhm.
again, that's the approach that endocrinologists learn in medical school during their training is let's just manage the symptoms, suppress the thyroid. And as far as radioactive iodine surgery, their mindset is, well, it's easier to manage hypothyroidism than hyperthyroidism because when you're hypo, you just take thyroid hormone replacement. Usually they give levothyroxine and that's their solution.
Right. And tell me if I'm right, but once you're on that levothyroxine, you're on it for life. You can't ever get off it.
Well, I mean, if you get your thyroid gland removed, 100%, yeah. If, for Hashimoto's, they usually do put people on for life. It's not like people can't get off. Um, but that's again, they're not doing anything for the immune system. So when someone comes in for Hashimoto's and they'll put them on thyroid hormone and say that's the solution. So just, we'll do a test once a year, adjust the dose if necessary. And then the person
Hmm.
figures, okay, well, I'll just keep on taking it. But it depends. I mean, some people do need to be on thyroid hormone replacements. And then if someone has been on thyroid hormone replacement, and especially if they're taking higher doses, for a long time, it really can be difficult to get the person to the point where they don't need it. But yeah, there are definitely people who take it who by addressing an autoimmune component, they're able to and again, I don't have prescribing rights, so I can't say like wouldn't say to or people listening here, I'm not saying yeah, let's try
Right,
taking a
right,
break or stopping your levothyroxine or Armor or whatever you're taking, but just mentioning that it is possible if someone has been taking thyroid hormone replacements, um, it is possible in some cases to get to the point where you don't need it, but the medical doctors typically won't tell you that. They'll say, no, you just need to continue taking it.
right. So let's back up a little bit. What exactly does the thyroid do? I mean, why is it considered so expendable that they can just pull it out like an appendix?
Yeah, well, it's yeah, definitely not expendable, but I mean, yeah, you could take thyroid hormone and it's not exactly the same, of course, as your body. Yeah, I mean, yeah, you could live without a thyroid just like you could live without an appendix, you could live without a gallbladder.
Uh,
But yeah, I mean, the thyroid gland, you have pretty much thyroid receptors in almost every tissue and cell in the body, and it controls. I mean, metabolic rate is what it's known for, but I mean, it's important for every like digestion, for health of the brain. I mean, just it's amazing, like cholesterol metabolism. So again, like if someone has elevated cholesterol and LDL, most medical doctors will be like, okay, let's put you on a statin to lower it.
right.
But maybe look at the thyroid. So someone has hypothyroidism, low thyroid, that definitely could elevate cholesterol and that could elevate, LDL. And so the person might not need a statin. They might need to just, balance their thyroid hormones and affects the bones, like with hyperthyroidism you typically get increased bone turnover, which could lead to osteopenia, osteoporosis. But then if you don't have enough thyroid hormone, it could affect bone quality and still you could be susceptible to fractures. So yeah, a lot of different functions for heart health. I mean, yeah, just like I said, it controls pretty much there's like I said, every thyroid, I mean there are thyroid receptors pretty much everywhere. And yeah, if you absolutely need thyroid hormone replacement, yeah, you could live a normal life. It's just sometimes it is difficult to adjust the dose. And then also an issue with levothyroxine, synthetic T4, is that some people have issues, or actually a lot of people have issues converting T4 into T3, which I mentioned earlier. With T3 is the active form of thyroid hormone. That's what actually binds to the receptors. And so and sometimes they won't even test T3. So they'll look at TSH T4 and then they might give the person T4 and they're not feeling good because it's not, and the numbers might not look good because the T4 is not converted to T3. But a lot of times they'll just say, let's take more T4, which doesn't make sense. If you're not converting it, yeah, you could give T3. That would be better than just giving T4. But why not try to figure out why you're not converting the T4 into T3? Most of the conversion takes place in the liver, about 20% in the gut microbiome. Then stress, high cortisol could affect that conversion. But again, doctors don't even, most doctors unfortunately don't even look at it. They just say, let's just keep on taking thyroid hormone. Or again, in some cases, let's take a synthetic T3 like Cytomel, and like I said, time and place for that. But, and it's not always easy to address the cause of the problem. So it's not made to, like when we talk about, like reversing Graves, reversing Hashimoto's, or getting into remission, whatever terms you want to use. Again, it's not easy, but it's still, to me, it's better than just taking medication, just taking thyroid hormone replacements. Again, time and place for that, but to me, that's not a long-term solution.
Thank you for helping to understand that because it is confusing to really understand what the thyroid does when doctors are like, well, we'll just take it out or kill it off with radioactive iodine. And a lot of us might know just in the general population that, oh, yeah, your thyroid has something to do with iodine, and that if there is radiation, your thyroid is susceptible to that, and that can be a problem, but maybe not really understand all the ways that the thyroid influences the rest of the body and how the body functions and feels. So, thank you so much for explaining all of that. When we talk about, or when you talk about your pillars for helping to support the thyroid and bring it to normal functioning, and you talked about diet, infection, parasites, and there was one more. Am I correct? What was the one more?
Yeah, so well, food, stress,
Stress,
chemicals, infections, yeah.
food, stress, chemicals, infections. Okay. So when someone comes in to work with you, what is the protocol that they actually start on? Do they start by clearing out all of those things and starting kind of from scratch? Is there a specific diet that you recommend? Um, how does that work?
Yeah, great questions. I mean, I always start with the foundation. So, like, yeah, like a healthy diet, stress, blackout time for stress management on a daily basis, not just every now and then, trying to get proper sleep, regular movements. And yeah, I mean, diet-wise, I have the book that, as you mentioned earlier, during the introduction to Hyperthyroid Healing Diet. A little bit misleading because it suggests that there's only one diet and I talk about three diets, and even then, we both know there's not like one diet or even three diets that fits everybody perfectly. So we need to make modifications. But I mean, I do commonly recommend for Graves and Hashimoto's like an autoimmune type protocol, like an AIP type diet. But for some people, that could be too restrictive. So like a paleo or modified paleo also could be a really good option. I mean, everybody's in a different place. For some people, if someone's used to eating, like McDonald's or Chick-fil-A or something like every single day, like we might need to say, okay, let's cut out the fast food. Let's maybe, like go gluten and dairy free. Like let's might have to take baby steps depending on the person. So,
Right,
um,
right.
yeah, like it's if someone's doing that, might be really difficult to do like that, go to like an AIP diet. So, but yeah, but it's important. I mean, the focus of the podcast is inflammation, and if you're eating inflammatory foods, even every now and then while healing, I mean, arguably when you're in a healthier state, you could get away with it a little bit every now and then, and it depends on the
Yeah.
person. Like there are like gluten, even in small amounts, could be really inflammatory, but yeah, while healing, you definitely want to be really strict with the diet. And when I say strict, again, it doesn't mean absolutely AIP for everybody, but it's not like every now and then you could have that slice of, slice of New York pizza or wherever you live, Chicago pizza, whatever. Yeah, I mean, even the gluten-free pizza you got to be careful about because yeah, it's gluten-free, but if you're getting it outside, especially, who knows what else is in there. But even if you're getting it, unless you're making it on your own, I guess then you might know. But if you're, getting wherever, eating out or getting that gluten-free pizza in a box, who knows how many ingredients are in there. But yeah, so diet's important. Stress management, again, just from my own self-experience, just it's a lot of people just underestimate the impact stress has on their health. And I recommend start out slow. Do 5 minutes per day, but do it every day. Get in the routine of stress handling. Um, and if someone doesn't have 5 minutes per day, then they really need to do this. Like if you can't find 5 minutes per day, then yeah, you definitely need to, that's a pretty good sign that stress is probably a big factor. So
So do
stress
you
management.
recommend meditation? What do you recommend for stress management?
I mean, whatever people are willing to do. I mean, if they're like, I will say this though, like some people will say exercise. I exercise as a form of stress management. I exercise regularly and I feel, it feels good when you exercise, but you want to do things to help get you more in a parasympathetic state and exercise. Again, like if you're going to the gym and lifting weights, doing some cardio, again, things I do. I mean, more so these days, more weightlifting and resistance exercise, but I do some cardio as well. And I do a lot of walking actually on my walking desk, on my treadmill desk. So I'm actually doing a lot of walking, keeping track of my steps these days. I never used to do
Uh-huh.
that, but I'm like, you know what? I have my treadmill desk and might as well like see how many steps I could walk. But just yeah, if it's deep breathing, meditation, that's fine. Some people prefer yoga. And so, and you could do multiple things. Like you could maybe a few days a week if you want to go to like a yoga studio or maybe, a lot of gyms have like classes and maybe, go to a class and then the other days just you stay at home and do some deep breathing, do some meditation. So really what people are willing to do and do on a regular basis. So there's not, again, same thing with diet. There's not one diet that fits everyone. And same thing with stress management. Different people are willing to do different things. There's a lot of apps these days too, which could be helpful, like the Calm app and Headspace. And so, and I,
Right.
and I, and I think it's fine. It's great not to rely on technology, but I can't say I mean, that's just the world we're in, that's what we're doing now, doing the podcast interview using technology. And again, if that's what you need to do to meditate and do some deep breathing, it's better than not doing it at all.
Yes. Okay. So when you talk about chemicals, are you mostly talking about chemicals coming in through your foods, or what kinds of chemicals are you talking about?
I mean, yeah, I mean that's definitely a big part of it. I mean, our food supply has pesticides and the microplastics. I mean, yeah, I mean, a lot of people unfortunately still are drinking out of plastic water bottles day in, day out, just buying the water bottles by the case, going to
Yeah.
Costco, which again, I like Costco, but not for the water bottles. So um but yeah, and again, I can't say again, years ago, I mean, I remember, maybe like 20 years ago, my wife and I used to get those like big 5 gallon like water. And again, they're harder plastic, and that's what I justified. Well, it's the harder plastic, so it's not as
Uh-huh.
bad. And maybe that's true, but it's still sitting in the plastic, so just yeah, so clean water, just I mean air as well that we breathe in, so air purifiers, and then cleaners and cosmetics. So it's not just the food and the water, but the products we use. And I mean, as a guy, usually on average, guy, men aren't using as many cosmetics as women. So, just but still, I mean, we still use like things like shaving cream and deodorant that might have aluminum and it's
Right.
and toothpaste with fluoride and all that. So, again, just so try to do your best. I mean, I guess the point is with the cleaning the cleaners and cosmetics you might not make these changes overnight, but maybe pick one or two items that you're using on a regular basis. Maybe it starts with the deodorants. If you're using a aluminum-based deodorant, maybe you try to find a more natural deodorants. And or if you're using a cleaner, if you're using like 409 or whatever other cleaners are out there on the market, maybe replace that with a natural cleaner or make your own using like vinegar, baking soda. But even if you buy one, if you don't want to make your own, it'll be more expensive, but it's not like you're gonna. I mean, the thing about organic food, it could obviously get expensive because you're going through it pretty quickly with the food. With the cleaners and cosmetics, like if you get a natural cleaner or natural deodorant or whatever, it's probably going to last at least a few weeks, maybe even a month or two. So it'd be a little bit more money, but it's not like it shouldn't in the long run shouldn't cost that much more. But um, yeah, and we could keep on going on, like even a mattress. We could say like, the off-gassing, but realistically, again, there's only so much someone's going to do. I mean, I can't say all my furniture in my home is like organic and natural. Um,
Uh-huh.
we do have a more natural mattress, I will say that, but but so but again, just try your best. So just that's I mean, we live in a toxic world and most of the toxins we're exposed to are inside our home. And once we're outside, there's not a lot we could do anyway. So I would say don't worry as much about when you're outside. I mean, but when you're inside, definitely do what you can.
Yeah. Yes, I would agree with that. Um, okay. Is there any other kind of main areas of life that people who have thyroid diseases should be aware about as they're looking to reduce the inflammation that the thyroid malfunction is causing?
Any other areas besides what we spoke about as
What
far?
we've, right, anything that we haven't talked about yet?
Um, I mean, the gut, I guess we haven't spoken too much about like the gut
No,
really.
we haven't.
So,
Hmm.
I mentioned it briefly early as the part of the triad of autoimmunity, but you need a healthy gut to have a healthy immune system. Most of the immune system cells are located in the gut. And so if you have a lot of gut imbalances, what's called gut dysbiosis, that could lead to, that could be a big factor in inflammation. And then also, if your gut isn't healthy, you might not be digesting and absorbing the nutrients that are important for reducing inflammation. Just like again, when talking about inflammatory markers and with autoimmunity, you have typically like an increase in what's called Th17 cells and a decrease in
Mm.
regulatory T cells. So regulatory T cells help to keep autoimmunity in check, whereas Th17 cells help to promote autoimmunity. And certain nutrients can really make a difference, like selenium and vitamin A, vitamin D, which I know is more of a pro-hormone than like a vitamin, but still, these vitamins, minerals are really omega-3 fatty acids. I mean, just now again, that's debatable as far as where you should get it because we were talking about the toxins, and we could say, well, the fish is toxic and all that, but again, it's a no-win situation. Little bit of a catch-22, but again, we need the omegas, regardless of whether we get them through the fish we eat or again take fish oil supplements. We need healthy omegas. So yeah, nutrients are important. But again, if someone's low in nutrients, I mean, there could be other reasons. Just the food it's not nutrient dense as it used to be. But again, the gut health is important. That's why I started a newsletter, Healthy Gut, Healthy Thyroid. Just because again, you do need a healthy gut to have a healthy, not a healthy thyroid, but really just an overall healthy body. And
Right.
yeah, from an anti-inflammatory standpoint, yeah, you definitely need a healthy gut.
And dysfunctional gut is a big sign of inflammation in the body. So
Yes.
it's something that I like to think about as I'm going through and talking to all these practitioners, that everything is really interconnected. So the thyroid affects everything else in your body too. And if one thing is off, probably lots of things are off. And their way to address it is not necessarily just to say, oh, the thyroid's having a problem. Let's just focus on some thyroid hormones. It's probably a lot of factors that are going on in the body that all have combined to cause whatever symptoms that you're experiencing.
Yeah, definitely agree.
So, thank you so much for this conversation. How can people find you and learn more about what it is that you're doing and offering?
Yeah, thank you. So yeah, definitely check out my podcast, Save My Thyroid, and then make sure you listen to Elizabeth's interviews as well while on there. You could visit either SaveMyThyroid.com and click on podcasts, or just visit your favorite podcast platform and type in Save My Thyroid. And let's see. Save My Thyroid, and then I have my books that you mentioned earlier. Two of them on hyperthyroidism, one on Hashimoto's that you can check out on Amazon, and also have I have a community called Healing Graves Naturally that you could check out by visiting SaveMyThyroid.com/ heal Graves disease, and it's a I do also have a few Facebook groups as well if you prefer Facebook, but this one's outside of Facebook, off of Facebook for those who don't like Facebook, and it's a pretty engaged group. So yeah, those are, and then also a newsletter, Healthy Gut, Healthy Thyroid, which you could check out by visiting SaveMyThyroid.com/newsletter.
Thank you. So, for everyone who's listening, this is Dr. Eric Osansky, Osansky. If you're looking for him, and this is where to go for all things, especially hyperthyroid. And thank you so much, Dr. Eric, for coming on today and for sharing all this great knowledge.
Yeah, thank you, Elizabeth. It was great speaking with you. Just yeah, honored to be on your podcast, and thank you so much for the invite.
Absolutely. I can't wait till we get to hang out together again. We've
Yep.
gone to like dances together and had meals. It's been really fun.
Yeah. Yeah. Same here.
All right. So thanks for listening today, and definitely check out Dr. Eric Osansky's books and learn more about whatever might be going on with your thyroid and how it is connected to the inflammation in your body. And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations. They work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.